My name is Dr. David Palestrant. I'm a neurointensivist trained in neurology, neurocritical care, and critical care medicine. I hold board specialties in neurocritical care, neurovascular neurology, and critical care medicine. And I take care of patients with severe brain injuries. For years, I worked in neurological ICUs, and I identified a gap in care. That's the point when patients come to the end of their stay in the neuro ICU and are ready to move on to the next stage. After sending patients out of the ICUs for years, I realized that there wasn't a next stage that focused on patients with neurological injuries. A lot of these patients remain fairly low level, they're not yet ready for acute rehab, and the facilities where they generally have been sent to in the past don't have the expertise to manage their ongoing complex neurological and medical issues. This program is unique in that it focuses at this stage of recovery as the patients are coming out of the ICU. It's the point of care where patients start to manifest their neurological destiny, but they remain very complicated both medically and neurologically and need a lot of focus both in terms of their medical observation, treatment, and rehabilitative services to help them come through the stage and move them on to the next stage, hopefully onto acute rehab, potentially home, or wherever they lie at that point neurologically. When they first arrive at our facility, they'll be assessed by our team, both including our physicians, the hospitalists, who have experience taking care of this patient population, and someone from the neurointensive care team. We'll identify the nature of the injury, try and get to the root of what we think their prognosis is, and then we start to devise a therapy plan directed towards their needs. This includes both medications that may help them wake up a little bit more, titrating down medications that may be inhibiting their recovery, getting the patients ambulating and moving and out of bed as soon as possible, working intensely with physical therapy, occupational therapy, and speech therapy, and then having weaning programs from the ventilator that are directed specifically towards their neurological needs. We target the whole host of neurological injuries, patients with traumatic brain injuries, strokes, subdural hematomas, post-neurosurgical patients, patients with neuromuscular diseases like Guillain-Barré, ALS, critical illness, neuropathy and myopathy, patients who have had neurological infections like encephalitis or meningitis. Essentially, anybody who has had a severe neurological injury is the focus of our program. Well, we've had many success stories. The ones that always come to mind are patients with severe traumatic brain injuries who have come to us in very low levels, patients who are comatose or what we call minimally conscious, that they have some awareness. And then they stay with us some have stayed up with us for multiple weeks. And during that time, we've seen them emerge from coma and deal with all the medical issues that have come about during that period of time. Things like agitation, motor restlessness, medical complications, and we managed them through this period and then sent them off to acute rehab. And now we've had multiple patients who've come back a year later who are back at home, integrated back into the community with their families, with their children, and that's the most satisfying case. Of course, we can't guarantee that's the case for all the patients, but that's the success stories that we're trying to work towards.